Pretibial myxedema is a skin condition that makes the front of the lower legs, the shin area, look thick, puffy, and sometimes orange peel-like. It is most often seen in people who have Graves' disease, an overactive thyroid that is caused by the immune system. Think of the skin on the shin as a soft pillow that has become overly filled with a jelly-like substance, making it feel firmer than normal. The main cause is an autoimmune reaction. In Graves' disease, the body makes antibodies that not only stimulate the thyroid, but also tell skin cells fibrofibers to produce too much mucopolysaccharide, a sticky material that draws water into the skin. This extra water makes the skin swell. It is like pouring extra syrup onto a sponge. The sponge swells and feels heavier. Smoking, uncontrolled thyroid levels, and certain medications can make the reaction worse. People with pretibial myxedema notice a soft, non-painful swelling on the front of each shin. The skin can feel tight, look shiny, and may have a dimpled peau d'orange texture. It might itch or feel slightly warm, but it usually does not hurt. In severe cases, the swelling can limit ankle movement, similar to how a tight band around a wrist makes it hard to bend the hand. Doctors diagnose it by looking at the skin, asking about thyroid history, and sometimes taking a tiny skin biopsy to see the excess material under a microscope. Blood tests check thyroid hormone levels and antibodies. Treatment focuses on controlling the underlying Graves' disease. For example, anti-thyroid drugs, radioactive iodine, or surgery, and soothing the skin. Common skin treatments include strong steroid creams, steroid injections directly into the thickened area, and wearing compression stockings that gently press the skin, much like a snug sock that helps flatten a swollen ankle. Preventing pretibial myxedema starts with keeping Graves' disease under control, regular thyroid checkups, taking medicines as prescribed, and avoiding smoking, which can worsen autoimmune reactions. Gentle skin care, such as moisturizing regularly and not rubbing the shin harshly, helps keep the skin barrier healthy. Imagine treating the skin like a delicate balloon. You want to keep the pressure even and avoid sharp pokes that could cause leaks. New research is looking at drugs that block the immune pathways that cause the skin changes. One promising medication, teprotumumab, IGF-1R blocker, originally used for thyroid eye disease, has shown early success in reducing shin swelling. Laser therapies and low-level light treatments are also being tested to break down the excess material in the skin. These advances are still being studied, but they give hope for faster and less invasive ways to smooth the skin in the future.